Hello. Good evening, everyone, and thank you very much and welcome once again and joining us for another edition of our monthly Facebook Live talk session. My name is Andrew. I'm the head of fundraising, marketing, and volunteer management at 365 CPS and your host for tonight's sessions. Now, tonight's topic is about colorectal cancer, understanding risks and treatments, and is kindly brought to you by 365 Cancer Prevention Society, our new cancer education partner, Pfizer, and our esteemed medical partner, Icon Cancer Center. So please like and share and also comment so that we know you guys are all ready for the session tonight. Right. So for those who have participated in our Facebook contest, so do stay tuned till after the talk, cause we'll be announcing the winners by then. All right, so details about Icon Cancer Center and 365 CPS is right now on screen. I hope everyone has taken your dinner and sitting comfortably, tuning in to us from wherever you are. All right. Now, 365 Cancer Prevention Society was founded in 2003 as a social service agency with IPC status and is a full-fledged member of NCSS. Now, the Society's mission is to serve the community through holistic cancer prevention measures. This is accomplished through health and nutrition education, promotion of healthy lifestyle, and lymphatics detox exercise programs. We also provide practical and emotional support and care for patients and their family members in their battle against cancer through residential and hospital visitations, counseling, and wellness services. Now, please remember that one is never alone in the fight against cancer. Right? We hope you can join our community in the fight against cancer today. Now, so for more information and to stay up to date about 365 CPS, our activities and events, do visit our official website. Follow us on Facebook, Instagram, and Telegram. So don't forget to also like, share, and comment on our social media pages so that more people can benefit from our charitable work. Now, before we proceed with tonight's program, kindly note that all information shared at this session by the speaker and 365 CPS are for general information only and subjected to change. Do consult your doctor for personalized and detailed medical advice if you have any. We respect your privacy, so please make sure that your questions are not too personal and it is something that we can share with the rest present tonight. Also, do let others have a chance to ask their questions too, right? Thank you very much for your cooperation. Now, to mark Colorectal Cancer Awareness Month in March this year, Icon Cancer Center and 365 Cancer Prevention Society decides to jointly organize the My First Colonoscopy campaign together with other partners like the Society of Colorectal Surgeons and StarMed Specialist Center. This campaign seeks to support individuals aged 45 to 70 years old from low income families and those who are at higher risk due to family history and symptoms to a fast track sponsored colonoscopy by experienced surgeons of the Society of Colorectal Surgeons, complete with a pre and post GP medical consultation at StarMed Specialist Center, meaning the beneficiary for this sponsored colonoscopy don't have to wait months for an appointment to see a doctor or to do the colonoscopy. Everything is done at StarMed Specialist Center, right, by qualified and experienced specialists from seeing a doctor to the scope, all in a matters of weeks only. And you guys are the one who are making all this possible too. So how can you help this and support in this awesome campaign? You can do your part in saving another by donating generously towards this campaign. And details are currently on screen right now. So you can actually scan the QR codes and also follow our Facebook page for more details. And also go to the online donation portals, giving.sg and Gives Asia. Now, if you want to know more about Icon Cancer Center, StarMed Specialist Center, and the Society of Colorectal Surgeons, do check out their website and Facebook pages, right? You can have more information there. Now, tonight's topic is about colorectal cancer, As we all know, colorectal cancer is a major killer in Singapore, common in both males and females. It is the top cancer in males and second most common cancer in females after breast cancer. Now, today we will learn about some of the common facts about this cancer type and the various treatments methods available. Tonight's guest speaker is Dr. Xiang Yip, who has over 10 years of clinical practice in medical oncology. He passionately believes that caring for patients with cancer involves caring for their physical, emotional, and spiritual health. Kindness, compassion, and providing each of his patients with the best evidence-based treatments are the heart of his practice. So let us all welcome and thank Dr. Shang, for taking the time in joining us tonight for this session. Now, of course, it's also the time for me to take a short break, after talking so much. So I'll hand over the time, right, to Dr. Shang. Dr. Shang? Good evening, Dr. Shang, and
Hi,
welcome.
Andrew.
Hi,
Okay,
looking great
thanks.
tonight.
Yes, yeah. Thanks for the kind introduction. Hi,
No
everybody.
worries.
Can't see all of
All
you,
right.
but I guess we can see a few comments, so we know that there's definitely some people there.
Yeah, the guys rocks. I think all of them are all ready to start, and all to you, right? The
Okay,
floor is
all
yours.
right.
Thank you. See you in
Thanks.
a bit.
Okay, all right. So let's welcome everybody. Like I said, I can't see you, but I know that you're all there. So tonight, I guess with all these talks, the main thing we want to say is I find that if you're going to make this useful, it's always good to be casual, and so feel free to ask the questions. We'll leave plenty of time for questions tonight. I will do about half an hour, maybe less, for the talk, so that hopefully most of your questions that you may not even have to ask, or you get the answers when you hear my talk. But even if I have gone through it in my talk, right, and you still ask, there's no stupid question, I will not scold you for saying, hey, that's already my talk. There will always be a good question, lah, and we'll try our best to answer it. So let's make sure that I hope that you, by the end of the night, you will just feel that you haven't wasted your time, but you've left feeling that it's been useful. Okay, so let's go into finding out a bit more about colon cancer. Myself, I am a medical oncologist. I work in private practice. I was trained in Australia, and then I moved back to Singapore around about 11 years ago. I was in Tan Tock Seng for quite a few years, but then I came out to private practice now about 7 years ago. So I work with Icon Cancer Center. I have clinics in Mount Alvernia and Mount Elizabeth Novena mainly. I look after colon cancer patients, but I also care for lung cancer and breast cancer patients, as well as what we call urogenital cancers, which are things like your prostate cancer, your kidney cancers. Okay, so that's me. Now, I think Andrew already mentioned about the statistics about colon cancer, so I won't talk too much about it. But why we're here tonight is because colon cancer is the most common cancer in Singapore among men, and the second most common cancer among females. Of course, for females, the most common cancer is breast cancer. So we won't spend too much time on statistics, okay? But if you all really need to know, any statisticians among you that really need to know, you all can ask me the questions later. But I do find that kind of things a little bit boring. Let's go straight into the things that are actually more useful. Things like, what are the symptoms of colon cancer? Because I think sometimes when we come here, those are the sort of things that we want to find out. Like, how do you know, right? Okay, I can tell you that among young people, among all sorts of people these days, there is a big fear that they may kena cancer, right? So what are some of the symptoms we can look out for? Colon cancer is one of those cancers that actually has symptoms. So it is something that you can actually watch out for. And the main thing, if you catch it, you want to catch it early, right? So very importantly, what are some of the things that we must be aware that can be a sign or a symptom of colon cancer? The most important one, and this one is really very easy for all of us to know, is change in bowel habits. Right? Change in bowel habits means, like, for example, everybody is different. Some people may go to a pass motion, go to the toilet once a day their whole life. Some people once every 2 days is normal for them. For some people, even once every 3 days is normal for them. And then for some people, they may even have diarrhea quite often, and that's quite normal. Right? But suddenly, if you find that over a matter of months, your bowel habits have changed, meaning that you used to go like very often, like once every day, and then suddenly now you're getting constipation very often, or you are getting diarrhea very often, when last time you're not getting all this. So that is immediately the first sign to look out for. This is the most common symptom for colon cancer. About 70% of colon cancers, right, present with a change in bowel habits. And it's actually an easy thing to look out for because we all go to the toilet. We're all familiar with how often we go. So we know when our bowel habits change. Now, of course, if it changes over 1 week, 2 weeks, don't worry too much about it. But we're talking over about 1 month, 2 months, where you know that something's not quite right. It's not the same as what they used to be, and that's when you need to go and see your doctor. Okay, so the bowel habits, that's the easiest thing to look out for. Second thing that's also quite easy to look out for then is bleeding, right? So when we pass motion, if you are all along you've never had any bleeding, but suddenly you find that, how come for a few weeks you are bleeding every time you pass motion? Once again, if it happens one time, two times, and then stops, don't worry about it. If it happens once or twice, like every few months, also no problem. Most of the time, that one is a little bit of tearing when we pass motion, sometimes a bit of pulse. But if it's consistently happening, right, over a few weeks, though, you mustn't ignore it. Okay, because the second most common sign is actually bleeding. Okay, now the third thing is a bit harder, but an abdominal mass. I guess sometimes if you feel like, how come there is like actually like you feel like your heart, your tummy is very very hard. You're not actually getting fatter, but you can actually feel a mass there. This one I have to say is not so common. This one often is picked up by doctors or close relatives. And then the fourth one is anemia. Because for colon cancer, many of the times patients can bleed very slowly, so they don't actually know. But what happens is that they start bleeding and they develop anemia. Anemia is whereby you actually don't have enough red blood cells or hemoglobin. And when you're anemic, you start looking very pale, you start being very breathless and very tired, every time over a matter of weeks. So once again, you start having symptoms of anemia, whereby, you're getting more and more tired, you're always breathless, no appetite, all these sort of things, then it's something you need to go and see your doctor. And then the last one, which is actually not very common, right, is abdominal pain. Some patients present with abdominal pain, but it's actually the quite rare sign or symptom of colon cancer. Okay, so once a patient comes to see us with all these symptoms and we suspect that there may be colon cancer, what are some of the tests we do? So the most important test to pick up colon cancer is what we call a colonoscopy. Now, Andrew mentioned this already. Just now we are sponsoring colonoscopies because colonoscopies are the best way to pick up colon cancer. So you see a picture here of a colonoscopy. It basically is a camera, right, put into the rectum, and we we look for basically like tumors like this, and if there is, we take a biopsy. Once we biopsy it, we look for cancer cells. Now, that's the main way that we diagnose colon cancer. There may be other ways, like things like CT scans, MRIs, and PET scans. Sometimes these things give us clues that there may be colon cancer, but everybody who is diagnosed with colon cancer will almost definitely need to have a colonoscopy. We'll talk a little bit more about when you should do a colonoscopy, okay, to prevent and catch colon cancer early. But really, that's the way we pick up colon cancers. Okay, so now I think at most talks that I give, right, I give all sorts of talks, but I think risk factors for colon cancer, for patients who tune in to a talk like this, who are actually well and are tuning in for some reason because maybe you've had a family member, you yourself don't have cancer, but you have a close friend or family member who had cancer, and that's why you're here. I know there are also some people here who have had cancer and want to find out a bit more about the treatments, but there are many who just want to know, how then do I pick up colon cancer? What should I be looking for? Should I be worried? Am I going to get colon cancer? So we'll spend quite a bit of time here talking about what are the risk factors for colon cancer. What are some of the things that may cause to increase your risk of getting colon cancer, right? Okay, probably the most important thing, one of the most important things I would say is the family history of colon cancer. Now, if you have a family history of colon cancer, if it especially is what we call a first degree relative, so that's like somebody who's like immediately related to you, right? Like your father, your mother, your sibling, or you immediately your risk of getting colon cancer is double that of the normal person who doesn't have any family history. So the first thing to be looking out for is a family history. Okay, and that's always something that we will always ask, whether there's anyone in the family who had colon cancer, because it is one of those cancers that are hereditary, in the sense that if your family member has it, there's a higher chance that you will have it as well. So if you have a family history, then that's a definite risk factor for you to get colon cancer. Now, aside from family history, there are also what we call some rarer genetic kind of conditions that can increase your risk of getting colon cancer. So now this one, right, I only mentioned it, but we won't spend too much time here because these genetic conditions are quite rare. They only make up about 5% of all colon cancers. But basically, if you ever have a very, very strong family history of colon cancer, meaning that it's not just one person in the family who has colon cancer, but many people in the family who had colon cancer, then you may have one of these kind of conditions. These two are called, there's one of them is called familial adenomatous polyposis, or called FAP, and another one that's more well known called Lynch syndrome. Generally, people who have these genetic conditions, you will hear uh, you will hear of a lot of people in the family have colon cancer, and then you also hear something of other cancers like womb cancer as well. So these are something to look out for. We do a lot of research about this, but it's not so common lah. Only about 5% of all colon cancers patients will have this particular kind of genetic syndromes. Now, if we suspect that you have this genetic syndromes, then nowadays it's actually very easy to test for these kind of genetic conditions. We can do blood tests, we can even take just your saliva, and then we send you to a genetic counselor to talk about all the possible implications of what if you have this cancer. So they'll go through all this before they test everything, and then explain to you that if you are proven to, if you're confirmed to have this, then there may be some implications for you, that even for some patients, for example, with FAP, even when they're teenagers, they have to start going for colonoscopy already because there's such a high risk of getting colon cancer. Okay, we move on from like that, like genetic reasons, right, to other non-genetic risk factors, right? So these are there are many things that you'll hear about, but these are probably the four most common non-genetic risk factors that are well proven to increase someone's risk of getting colon cancer. So inflammatory bowel disease. Now, this is not irritable bowel disease. A lot of my patients get get mixed up. Irritable bowel is where sometimes you hear of patients who say every time they get nervous, they need to pass motion. Inflammatory bowel disease is actually a condition whereby you actually almost sometimes have ulcers in the stomach, very commonly, or inflammation in the stomach, and they actually can have a lot of painful tummy pain at a very early young stage in life already. And often it's also picked up on colonoscopy. So if you know that you have a history of inflammatory bowel disease, what we call Crohn's or ulcerative colitis, then we do know that these conditions do increase their risk of getting colon cancer. Now, this second one is definite risk factor, but not so common, right? If you've had abdominal radiation, so this especially we would watch out for young patients who may have had things like women who may have had like some pelvic cancer, and they had radiation when they're very, very young. When they get older, they may have a higher risk of getting colon cancer. Young teenagers who have had like things like sarcomas, and they've had radiation, or lymphomas where they've had radiation, sometimes they have a higher risk of getting colon cancer when they grow older as well. Okay, now, and then the second two things, right, are possibly some of the reasons why in Singapore we have a high risk of colon cancer. Obesity rates around the world, but in Singapore it's not spared, have increased. So we do know that if you are obese, your risk of getting colon cancer is higher. And likewise, diabetes, we have one of the highest diabetes rates in the whole world. And hence diabetes also increases someone's risk of getting colon cancer. So these are some of the common risk factors, some of which we can do something about, like obesity and diabetes. Some a bit harder, like radiation and bowel disease and genetic conditions. Okay, we'll spend a little bit time on diet, right? Because Singaporeans, I tell you, the one question that almost everybody asks, I mean, every time I get a new patient, an old patient, besides for them wanting to know about how to treat their cancer, they always want to know what food they can eat, what food they shouldn't eat, what food is good, what food causes the cancer. So, colon cancer is definitely one of those cancers that are linked to diet. The two most common culprit in terms of food, right, for causing colon cancer are these two, processed meats and red meats. Now, so processed meats are things like your sausages, your bacon, your hams, all these sort of things have definitely been shown that a high intake of this, right, have been shown to increase someone's risk of getting colon cancer. Likewise with red meat, especially probably red meat cooked under high fires, like until it's like chao ta or char grilled. So red meat and processed meats are definitely known to cause colon cancer. Now, however, I would say that don't panic, okay, and say I will never ever eat any of this kind of food ever again. The truth is that in most of the studies that show that there's a link between these meats to cancer, they found that the patients who got the cancer often took actually quite a lot of this meat, you know. So with processed meats, they found that really you needed to take almost like every day 50 grams of processed meat, and with the red meats is like almost like 100 grams of red meat almost every day to increase your risk. So in fact, the most of the cancer guidelines will say that a little bit of red meat, a little bit of processed meats, like once a week even or twice a week even, is actually okay. It doesn't seem to increase your risk that much. So while we do know these meats do cause cancer, don't panic. You have it once in a while, even up to once or twice a week is actually seen by most cancers guidelines as being quite acceptable. Okay, so doesn't mean you don't have to eat meat for the rest of your life. Okay lah, but this one absolutely no lah, huh? This one everybody knows lah. Smoking is bad. You know, so we need to absolutely cut down smoking lah. Smoking doesn't just increase your risk of colon cancer, but a lot of other cancers as well. So any amount of smoking is no good. The only good news about smoking is that when you finally do, if you're a smoker and you do stop, the risk of you developing cancer drops less and less with each passing year. So the earlier you stop, the better. Or if you have family members, don't some of them say to you, I already smoked for so long, already stop for what? You know, tell them that look, even if you stop now, there is a benefit. The longer you stop, the better it is. So it doesn't matter how long they've been smoking. The earlier they stop, their risk of developing cancer actually drops with each passing year. So always, we strongly encourage everybody to, of course, stop smoking. Now, alcohol is another one. Alcohol intake has actually been increasing as well in Singapore, and that may be one of the reasons why also we actually have higher cancer incidence rates like colon cancer. Certainly, any amount of alcohol, unfortunately, has been shown to increase the risk of colon cancer. So once again, you know, it's hard to tell everybody to absolutely don't drink alcohol. Some people like to have a bit of wine and all that. There's no good alcohol lah. Whiskey, wine, beer, everything in terms of cancer, everything, right, even in small amounts, slightly increases your risk. But the more you drink, the worse it is. And the worst kind of drinking is what we call binge drinking, whereby you may not drink the whole week, but then on the weekend when you finally stop working, and then you Friday, Saturday, Sunday, boom, you hit like, you know, like 20 glasses of beer or something like that. That's probably the worst stressor in terms of causing cancer. So alcohol intake should try to reduce. Okay, so enough of the bad news about what are all these risk factors. We talk about all those risk factors. You can feel free to ask me a bit more about those ones later. But let's talk about some of the good things. What are some of the good things, right, we can do to decrease your risk of getting colon cancer? So physical activity and diet, I'll talk about later. Calcium, vitamin D. Now, these are all the last three. Just to briefly tell you that there have been studies showing that if you take calcium, calcium with vitamin D, it may decrease your risk of colon cancer a little bit. It is, I wouldn't say it's definitely very, very convincing, but yes, there are some studies that show that some calcium with vitamin D will decrease your risk of getting colon cancer, and certainly aspirin as well. Now, aspirin has definitely been shown, just every day taking some aspirin by reducing inflammation, it does reduce your risk of getting colon cancer. Now, we generally don't encourage everybody to take aspirin just to reduce their risk of colon cancer. But sometimes if patients have like already some heart problems whereby aspirin is needed, you know, then at least there's a double effect. Since they need to take the aspirin for their heart problems, then we know that there's also some benefit in maybe preventing their colon cancer as well. Okay, but I said I need to talk about physical activity. One of my favorite things to talk about physical activity. Everybody asks me what can they do, and then they were waiting and waiting for me to tell them, okay, you eat this, you drink that, and then you'll be better. Then I tell them, no, there isn't all those kind of special. You just need to exercise, and then they are not happy. But you do need to exercise. Okay, exercise is definitely proven to show that to reduce the risk of many cancers, not just colon cancer, but breast cancer, lung cancer, womb cancer, prostate cancer. And you need to do for at least about 150 minutes of moderate activity every week. So that's about half an hour, 5 times a week. Moderate activity is brisk walking at least. Of course, you can go to running, if you can, swimming and all that. But you need to be aiming for that kind of activity, okay? And that is well proven to reduce your risk of getting colon cancer. Okay, what sort of food then is good to eat? Now, we do know for colon cancer, fruits and vegetables are very good. Okay, uh, patients who have a high intake of fruits and vegetables have definitely been shown to have a lower risk of getting colon cancer. So make sure that your diet, you must always have fruits and vegetables. Okay, so that's about it for risk factors. We'll go on to talk a little bit about screening and how to detect colon cancer, and then we'll talk about the treatment. Okay, so the key for colon cancer or any cancer is to pick it up early. You know, you don't want to be like this famous sheep, right? They went into hiding for in New Zealand for many many years, and when they finally found it, all the wool was all overgrown like that. You want to pick up cancer when it's young and early and easy to take care of. So that's the key to beating cancer, is picking it up early. So don't be afraid of cancer, but you know, we must detect it early. How to detect cancer early is through what we call cancer screening. The whole idea of why cancer screening works is that if a cancer is picked up early, it's curable. And cancer screens are just tests that can help us to pick up the cancer in its early stages. Now, colon cancer is a very effective screening program. Okay, why? So because colon cancer has a pre-cancer phase. What do I mean? Colon cancer, before it becomes cancer, often present as polyps. Polyps are actually still benign, but if you leave it alone, many of them will become cancerous, which is why we can pick up colon cancer early through colonoscopies. So we now, in Singapore, we encourage all patients who are 50 years old to go for a colonoscopy. Okay, so if you hit 50 years old, you've never done a colonoscopy, we encourage you to go and do one. Okay, now a lot of people, colonoscopy, some people hear stories about it because they hear about because you got to clear your bowels with some bowel prep, which causes a lot of diarrhea. Some people are a bit scared, and the idea of a camera going up your rectum and all that into your intestines is a little bit scary. Actually, you're asleep the whole time, so it really isn't in that difficult a procedure to do. So we really encourage everybody, because it's the best way of picking it up early. 50 years old, like I said, if you don't have much of a family history, and then you might do it every 5 to 10 years. Now, if you really say cannot, no matter what, I'm not going to do a colonoscopy, then there's a second best test, which is you check the stool for blood, or what we call a fecal immunochemical test. So that one is where we get a stool sample, and then we check whether there's any bleeding. And if there is, then you have to go to colonoscopy. But if there's no bleeding in the stool, then you can maybe defer the colonoscopy. Okay, so colonoscopy when you're 50 years old, but sometimes it may be younger. So that's where sometimes you look at things like family history. If you have a very strong family history, then you may go even younger. Often, maybe at least about 10 years before the age of the youngest person in the family who got colon cancer, or 40 years, whichever comes earlier. Okay. All right, and then we will finally talk about treatment, okay, which we will only spend maybe another 10 more minutes lah. I wouldn't spend, even though this is the area which I do mostly of in terms of the treatment. I find this is a difficult one to talk about because there's so much to talk about. So sometimes I entertain individual questions will be easier. But the main thing to know about colon cancer is that it is multidisciplinary. What does multidisciplinary mean? Means that it's not just me, the medical oncologist. You often need a lot of people, a whole team, in order for you to deal with this cancer. Okay, and that team is often a team of surgeons, medical oncologists like me who give chemotherapy, radiation oncologists, and also once again me who give targeted therapy. But these are the main ways in which we treat colon cancer, usually through a combination of surgery, chemotherapy, targeted therapy, and maybe radiation therapy. Okay, chemotherapy. Sorry for the slides. They came out a bit funny in terms of the wordings. Chemotherapy, I think we all know about. Chemotherapy has been around for a long time. It's really since after World War II, which chemotherapy was invented, and we have used it now for 50, 60 years. And it's still one of the main ways in which we beat colon cancer. So even for early stage colon cancers, like some stage 2 cancers and stage 3 cancers, after surgery, they will need some chemotherapy in order to make sure we mop out all the remaining cancer cells, and then reduce the risk of them ever developing cancer again. Chemotherapy is usually given intravenously. or sometimes if it's a combination with tablets as well, it's almost always can be given for colon cancer as an outpatient. It's usually maybe once every 2 weeks, once every 3 weeks. And how long? Some people have it for 3 months, some people need it for 6 months, some people need it for longer. Okay, so it all depends on the stage, often the stage and the type of colon cancer. Side effects of chemotherapy are well known. It can drop your immune system, your blood counts, it makes you tired, and obviously it can cause you nausea. Now, a lot of for colon cancer specifically, a lot of times the drugs don't actually cause hair loss, so that's one of the good things. Colon cancer chemotherapy is, compared to other chemotherapies, probably not so strong. Okay, so it's a little bit gentler, a bit easier to tolerate compared to other types of chemo. Okay, besides chemotherapy, a very important way in which we fight colon cancer is also called targeted therapy. Now, targeted therapy is different from colon cancer in that we target often the mutations on the colon cancer cells. So it's a lot more accurate in the way it kills the cancer cells, and so generally has a lot less side effects. Common drugs that we use in fighting colon cancer cells, a very well-known one is this drug called Avastin, which is pictured in this diagram here, in which Avastin actually attacks the blood vessels around the colon cancer cells. And by disrupting the blood vessels to the colon cancer cells will start to die because they don't get their nutrients from your blood supply. So Avastin is a one that we've been using for a long time already, well over like 15 years or so. But then there are, of course, newer ones, things like tablets as well, that we also help. They're also used to fight like later stage colon cancers. So the main features of targeted therapy is that because unlike chemotherapy that, as you all know, kills some of the good cells, targeted therapy tends to affect less of the good cells. So the side effects are better. It can be intravenous, which is through a drip, or it can be tablets, but it's often more expensive than chemotherapy. Okay, and then finally, for my last 3, 4, 5 slides, we talk about immunotherapy. I think if you have tuned into a cancer talk anytime in the last 8 years, you will know about immunotherapy. But just for those who've never heard about it, immunotherapy is very different from all the other ways we've treated cancer traditionally, right? Rather than attacking the tumor, immunotherapy really boosts your immune system, and your own immune system fights the cancer. So really, it's changed the way we treat cancer for the last almost 10 years now already, to the point where about 4 or 5 years ago, the scientists or doctors who invented immunotherapy were awarded a Nobel Prize in medicine. The main reason why immunotherapy was so has changed oncology so much is really because of a few features about immunotherapy that are very interesting. Number one, the way to understand it is that it kills our cancer cells by activating our immune system. It works for many cancers, not just for colon cancer, but for many types of cancers. It has much less side effects compared to chemotherapy because it's really harnessing your immune system. But probably the most important thing is that for immunotherapy has really changed the game. It was a bit of a game changer for many cancers. Many cancers, even in the late stage or stage 4, that we traditionally were never able to cure, we were starting to see after they were given immunotherapy, we started to see like percentages of them, for even for some lung cancer patients, up to even like 25 or 1/4 of them who would already last time, like, before immunotherapy would have been dead within like a year, they were living well beyond 5 years, like almost cured of it. So immunotherapy, besides being well tolerated, has also been shown to be extremely effective for many cancers. Now, for colon cancer, I have to say immunotherapy isn't really a huge weapon that we use, mainly because only about 5% of all colon cancers are very responsive to immunotherapy. So if we do some tests where the patient gets diagnosed with colon cancer, and if they happen to have certain features of their colon cancer, what we basically call the microsatellite unstable cancers, then these kind of patients, actually we give them immunotherapy rather than chemotherapy, and they usually respond very well compared to other colon cancer patients. Okay, and really that is my final slide, this one, which is that colon cancer is really something that we've known about for a very long time. But over the years, we now have many ways in which we attack it. and by really teamwork, improvement in treatments, improvement in screening, all we are seeing that patients are the survival rates for colon cancer has improved year by year. And certainly we are picking up colon cancers much earlier these days with all the screening programs. So slow, even though it's the most common cancer in Singapore, we are hoping that with all further progress, it is something that we will one day see huge improvements in. All right. Okay. And I think with that, let's I'll welcome Andrew back to the chat, and then we can address some of the questions that have come up.
Yes, that's right. Thank you, Dr. Chang. Thank you very much for very comprehensive and informative content that you shared earlier. So I also hope everyone has picked up some useful tips, right? Remember, folks, early detection saves lives. Now, time for the most anticipated segment, which is the Q&A. Now, before I start, I think from a layman perspective, right, I would just like to ask the doctor. So, is colon cancer and rectum cancer also known as colorectal cancer?
Okay. Um, yeah, so generally, that's a great question to start. Look,
Mm,
colon cancer is actually called colorectal cancer.
mm,
Because actually your colon and your rectum is almost like it's the big intestine and then it merges out to the rectum. The
mm,
cells and all in the colon and the rectum are very similar. However, they behave a little bit differently, Andrew.
mm,
Rectal cancer is treated differently. Number one, rectal cancer is actually a more difficult surgery because the rectum is where the anus is, and as you know, for the anus, we have this thing called a sphincter. The sphincter is what closes to prevent all your
mm,
stool and all that from coming out. It's much harder for a surgeon to preserve the sphincter, so that because if you don't preserve the sphincter, you will always, you're incontinent for the rest of your life. So
mm,
it's a much more difficult surgery. Because it's a much more difficult surgery, we often almost to all rectal cancer patients, almost all of them will need radiation, preferably before surgery, because we need to shrink the cancer so that the surgery is much easier to do compared to normal
mm,
colon cancer. Most colon cancers we don't actually need to have surgery, but rectal cancer, we need to have, most colon cancer, we don't need to have radiation.
mm,
But almost all rectal cancers, we need to do that simply just to preserve the sphincter. So they also behave a little bit differently. Rectal
mm.
cancers tend to come back to the rectum and they can actually spread to funnier areas. But other than the radiation and all that, we usually, when you hear rectal cancer or colon cancer, when somebody says that, it's often the same thing.
I see. Okay. So, I mean, earlier on, you also talk about, spending longer time in the toilet and all. I hope the ladies in our audience don't go spot checking on your hubby and say, hey, my husband always spend a lot of time in the toilet, is it displaying symptoms of colon cancer and all? I think please do not be so hyper on that. Your hubby could be just reading the newspapers or playing some mobile games, right? So spending too much time in the toilet doesn't equate, right, to colon cancer, right? At the same time, I think a lot of us, you mentioned about checking our bowels or our stools. I think a lot of times we all, do our business already, straight away close, flush, right? Especially men, right? If we don't cover up, the toilet bowl, and then we probably get nagging from our wife and say, how come you never close the toilet seat and put down the toilet seat and flush, right? So do check our bowels, right? So that we know whether there's any abnormalities, and at least we can seek help early, right? At the same time, I think with COVID, right, a lot of us are pretty worried about COVID, but just a side, track on things. I think with COVID, it does kind of help us quite a bit in lowering down our risk of colon cancer. I'm not sure, Dr. Shang, you agree, because nowadays, right, all the drinking outlets close at 10:30, so you can't really
Mm,
drink overnight until you knock out and become a Malayan. So you drink lesser alcohol, right? At the same time, and even CNY now, a lot of people can't really go and queue up for bak kwa, lim chi guan long shortest queue, right? But it's okay lah to eat bak kwa only during Chinese New Year, but don't eat it every day, At the same time, also nowadays cannot go East Coast Park to book a barbecue pit and barbecue and have barbecue every weekend. So I
Yeah.
think that COVID situation now kind of help to
Yeah.
you know lower the risk for
Yeah.
us lah in a sense.
Yeah.
But
Yeah.
good advice. I think you like you say keeping down all the red meats and eat in moderation. I think that is very useful advice.
Moderation. That's right. Don't worry too much
Yes.
about it. Everything with moderation is good.
Yes,
It's
that's right.
okay.
Yeah, too much of anything is no good, huh?
That's
All
right.
right. So,
Mm.
let's start off. We got a question from Gyokti, right? She was saying, with excessive stomach pains, right, and then exercise even more painful, right? I'm not sure whether is it because
Yeah.
she do a lot of
Yeah.
crunches or planking, so stomach pain, right? So does that equate, or symptoms to colon cancer?
Yeah, okay. So like I mentioned, right, this actually abdominal pain is the least accurate symptom for colon cancer, meaning that it's really not very common to get abdominal pain with colon cancer. So if abdominal pain is the only symptom and you don't have any change in bowel habits, there's no bleeding, your appetite is all
Mm,
still good, it is unlikely to be colon cancer. Having said that, of course, if it's persisting abdominal pain, it's also not normal. So it may not be colon cancer, but it may be something else, depending on your age, depending on your gender, depending on your history. There are so many other common causes of abdominal pain, things,
mm,
ulcers, endometriosis among females. All these can cause abdominal pain, much more common reasons. So whatever it is something that you should check out. And
yeah.
often you will still be suggested to have a CT scan and or an ultrasound or a colonoscopy at some stage, but it's not
Mm.
so likely to be colon cancer.
Right. And yeah, it's true. Early detections. Don't wait until you got really bad stomach pains, then you start suspecting that it's colon cancer, then you go and do a colonoscopy or whatever. So I
Yeah.
mean, if you are that age group, right, do get screened.
Yes, that's right.
Right. So yeah, the next question we have from Renee. Renee was saying, the family members may not have the symptoms, but and also it's not. I mean, have the symptoms, but not genetic. So is that equates to a high chance of getting colon cancer?
Okay, so Renee, I assume your question is, you means your if you are meaning that the family members have had colon cancer before, I assume I'll answer based on that, and correct me and
Mm,
type in the comments if that's not what you're referring to. But I
mm,
assume if you're saying that some family members have had colon cancers before, but it's proven to be not genetic, whether you still have a high chance. So in the scenario whereby there are family members who have been shown to have colon cancer, and you all have done the genetic test to check for the FAP and Lynch syndrome, and you don't not have it, you you still have a higher chance of getting colon cancer. Not as high as those that genetic syndromes, but you do have a higher chance. Now, how high that chance depends on how closely related the relatives are, whether it's a first degree relative, a second degree relative, a third degree relative, and also how many relatives there are. So certainly, is this something that if you have many family members having colon cancer, um, you may be recommended to do genetic testing, and if that's been done already and shown to be not there, you may still be asked to start cancer screening earlier than the 50 years old, depending on who was who was affected with colon cancer and how old and how young they were when they were affected.
okay. All right. So the next question is from HS Yo, right? He says that based on what you recommended
Wow.
to
What?
do
Okay.
colonoscopy, yeah, the age
Open.
group, so
Yeah.
until up to age of 74. So does that mean that those beyond 74 don't need to do colonoscopy?
Oh yeah. Okay. Yeah, actually I get
Mm,
this question quite a lot. It's only
mm,
because we okay, it's recommended because we don't know whether most of the studies they haven't really screened people above 74 years old. So that's why most screening programs do have an age limit, even for mammograms as well. We are not sure if screening women above 70 years old with annual mammograms or every mammograms every 2 years has been shown to improve their survival. The main thing about screening programs for population is that if you do a lot of it, you hope that less people will die from the cancer.
mm,
So by the time we know that it definitely works when between the 50 to 74 years old for colonoscopy. But beyond 74, we don't know if it still helps lah. Why, if you live to that age, really, not that you won't get colon cancer, but to screen everybody, just who get to 75, hasn't been shown in all these screening studies to work lah. So not that you shouldn't do it. It's still something you need to discuss with your doctor, especially if you already done a few by the time you get to 74. But we can't recommend it for the whole population.
Mm. Okay, and he has went on to ask, what is the risk of perforation, for colonoscopy?
Okay. So I don't do the colonoscopies. They're normally done by what we call the gastroenterologist or the colorectal surgeons. The risk, right? We know. I think they will tell you it's often only about 1% or less. It's usually less than 1%. So it's not a high risk procedure at all. We almost never. We rarely ever see perforation. It
Mm.
does happen once in a while, but the documented risk is definitely 1% or less.
Mm. Okay. So we got another question from Ming Hui, right? The question is how to tell the color of stools, which you mean that you are
Okay. Good
getting
question.
colon cancer.
Yeah.
Yeah.
So Minghui, look, the color of stools, right, for colon cancer, if we should always generally kind of look at the color of our stools. There are a few colors to be worried about, but mainly for colon cancer, actually, it's not so much color of the stool, but blood. Okay, so for colon cancer, right? If you have colon cancer, the stool color may not change because you normally actually see blood. Okay, if you may actually see bleeding from the when you pass motion. The reason being that the colon cancer is in the large intestine most of the time. So I mean, it is in the large intestine to define as colon cancer. So with the large intestine is actually very very close to our rectum, our anus. So if it bleeds, the blood will come straight out. It wouldn't have time to actually stain the stools. Whereas the blood bleeding that happens higher up, like for example in the stomach or in the small intestine, by the time it comes out, the stools look black. So colon cancer, actually you rarely have black stools. Black stools are more a sign of stomach ulcers, right? Where there's bleeding further up. So color of stools actually don't change much in colon cancer. All right, but what you actually do, if you see anything, you actually see bleeding.
Mm. Okay. All right. So the next question comes from Zen Lee. I hope I pronounced your name correctly. Right. The question is with the suggested therapy, right? Is it possible to rank the therapy based on its effectiveness? Well, this
Okay.
one like really,
Yeah,
school ranking like
good,
that.
good question. Okay, good, very good question.
Mm.
And in a way, I guess yes and no lah, huh? Yes, first, why? Of course, with every these days with every cancer, we look at many things. We look at the stage, we look at the type of cancer, whether the cancer happened on the right side of the colon, the left side of the colon, and then when all that we know all the information, we do genetic studies as well, looking at what we call microsatellite stability, and we put all this data together. And when we put this data together, we know that there are many trials done for all these different types of colon cancer. And then once we know about what sort of colon cancer it is, we do so it's a very personalized treatment. So there is a best therapy, the most effective therapy for each colon cancer patient. And how that's often decided is often through a discussion between the surgeon and the medical oncologist like myself. So no colon cancer, very often colon cancers do not get the same treatments. Some colon cancers you see, like I said, if it's very low near the rectum, I may have to add radiation. And that may be the most effective way to make sure we beat this cancer. For some other patients, they may only need tablets because we know that their cancer risk is of with the surgery and just the tablets alone, the cancer won't come back already. But some will need tablets and with the drip. So there is a most effective treatment for every single patient, and often this is not something I come up with by myself. These are all done by like many clinical trials done over many decades, whereby we've studied thousands and thousands of patients, and we know which is the best kind of treatment that works. So there is indeed a most effective therapy and best therapy for every single different type of cancer, but there isn't. But why is it no? There isn't just one best treatment for every single colon cancer. So every colon cancer is slightly different. So you can't say that, okay, this particular chemotherapy drugs are the best or this particular type of surgery is the best, because it all depends on the type of colon cancer.
Mm. So basically, it's different strokes for different folks, right?
Yeah,
It's very
that's right.
subjective.
Yeah.
All right. So next we have Gloria. Gloria wants to seek your opinion about taking organic fruits and vegetables, and then what's the best way to get rid of pesticides in fruits and vegetables?
Okay. So organic diet is something I get asked about a lot. Okay, ever since it started getting popular, about 10 years ago or even longer than that already. Now, the reason why organic diets got popular was because probably a while ago, they were shown that all these pesticides and chemicals and all these sort of things may increase someone's risk of cancer and other diseases as well. Now, organic diets are probably become trendy only in maybe the last 10, 15 years. The answer is we still don't know what the answer is, whether taking organic diet. So from as a doctor, as a specialist, what we do is we study epidemiological studies, or what we call studies where you follow population. So if we study, for example, thousands of people taking organic diets, we need to follow them up for quite a few years and see whether then all these people who take organic diets, whether they then have a higher risk of lower risk of cancer, whether they live longer than the average population. So because organic diets are fairly young, we don't have a definite answer to say that organic diets help to reduce cancer. Okay, so I cannot recommend all my patients to say they should take an organic diet. But if patients ask me, and I tell them that, look, if it's something that you feel you can afford, you can switch to, there probably is, in theory, a benefit in switching to an organic diet. It's expensive for sure, lot more inconvenient, but in theory, it makes sense. That you should have a lower risk of getting cancer, not just colon cancer, but cancer in general, by switching to an organic diet. But I can't say that it's only a theoretical answer to your question. So right now, I can't say that it definitely works. What is the best way to
Mm.
get rid of the pesticides? I like I said, switching to an organic diet is a true organic diet lah. I mean, we also know that there are many people who say it's organic, and we don't know what actually happens at the back end. But if you have a reliable supplier who's well proven to have supply with organic food, then it is probably the best way of getting rid of all these pesticides lah.
Mm.
Um, you know, Otherwise, cook your food well.
Yeah.
Eat things in moderation. I think for most of us, we maybe not so much finances, but don't want to put in that whole effort lah to switch to an
Mm.
organic diet. Then in that case, then eat
Mm.
everything in moderation. Less red
Mm.
meat, less fatty food, less oily food, and more fruits and vegetables. All these things are known to
Mm.
help lah.
Yeah. Alternatively, join the latest trend to become an urban farmer, grow your
Oh
own
yes,
vegetables and fruits. Yeah. So I mean, it's been getting very popular, right? So
yeah,
yeah, get some tips on that. Maybe
yeah,
that would be one source, right?
yeah, yeah,
Okay, we have a question from Corina. Um, she's asking colon metastasis to
yeah,
lung. What would
yeah.
be the treatment if immunology not
Okay.
suitable?
Yeah. Okay. So, for colon cancer treatment to the lung, now, colon cancer running to the lung is not as common as colon cancer running to the liver. In general, colon cancer that runs to the lung, the patients tend to do a little bit better than colon cancer patients that have the cancer has spread to the liver. Um, how to treat it? In general, you will definitely need chemotherapy to help to control it, help to shrink it. You may also need radiation. So sometimes we may, if it's not many spots in the lung, sometimes adding a bit of radiation to zap all the spots in the lung will help. And in some cases, even surgery. So all that depends on how much the spread of it is in the lung. But really, chemotherapy, and then of course targeted therapy as well. So these are the common ways. Definitely, chemotherapy plus minus targeted therapy will be yes, 100%. Most of them will need it, but sometimes also radiation, sometimes also surgery. Immunotherapy, like I said, it doesn't work for most colon cancers. Only about 5% of the colon cancers.
Hmm. Okay. All right. We got another question from Bell, right? Maybe Bell, I tumpang your question a bit also, right? You're asking, are people with constipation problem more at risk of getting colon cancer? So similarly, other than constipation, how about
Yeah.
those with IBS? Are they of
Yeah.
a higher risk?
No. Okay. So the answer is no. Patients just who have constipation don't have a higher risk of getting colon cancer. It's like I said, it's more so there are patients who have
Mm,
who their whole life they just always generally have more constipated, easily more easily constipated than other people, but they don't have a higher risk of getting colon cancer unless it's a new thing. Like I said, so the most common
mm,
symptom is a change in bowel habit. So if you've always been regular and then suddenly you're constipated now very easily for the last few months, then that may be a sign of colon cancer. But being just easily constipated itself is not a problem. Now, having said
mm,
that, uh, if you're constipated because you eat very, very few fruits and vegetables, then that's not
mm.
good. Then because then really fruits and vegetables do lower your risk of getting colon cancer. So it all depends on also what. But if you're eating lots of fruits, lots of vegetables, drinking enough water, and you're still constipated, then genetically maybe that's just how it is. So you wouldn't have a higher risk of getting colon cancer just because of that.
Okay. Right. The next question comes from Angie. Right. Her question is, does blood test tell you whether you have colon cancer?
Okay. No. So we do a colon cancer marker. The cancer marker is called a CEA. It's a screening. It done in some health screening and all that. Now CEA is if you have colon cancer, there is a chance that your CEA will go up. But CEA very famously, very commonly have what we call false negatives, meaning that even if you have colon cancer, especially colon cancer in the early stage, like stage 1 or stage 2, your CEA will still be negative or normal, you know. So there is a blood test that we do regularly to check for colon cancer. Once the patient has colon cancer, we often check the CEA because it can be used as a way of monitoring the patient in future. Um, and also a way of seeing when they respond to treatment. But generally, it's not a good blood test to just walk into your GP and say, I want to do it. So, not great. Now. It's going to change. Okay. So, for people like Angie who's interested, is all this is all going to change in the next 5 to 10 years. The way we detect cancer is going to change quite dramatically in the next 5 to 10 years because in the recent years, we've now discovered very effective ways of picking up cancer in the blood through what we call circulating tumor cells and tumor DNA. So all these tests are all now been done. They are all done. The clinical trials are all being done right now. And in about 5 to 10 years, we all believe that it's going to be quite readily available at your GP. Maybe the government insists you have to come and see someone like me, but more likely to just the GP. You can walk into the GP and then screen for colon cancer on a blood test. So akan datang, it should come. We all hopeful, and that will really change the way in which we screen. So what I've said today may even completely change in the 5 to 10 years. It may not be colonoscopies. It may be you walk into your GP one day and you do exactly a blood test. And it can screen you for ovarian cancer, breast cancer, colon cancer. Those technologies all there already, but extremely expensive right now. So we're only doing them in clinical
Mm,
trials. But once that becomes affordable, then yes, we will be able to screen cancers in a very different way and effective as well.
yeah. Agree. I think the advancement is not just purely on IT, but also in terms of the medical field.
Mm,
Advancements are progressing very fast as we speak.
yeah.
We got a question from Hai Lu, right? You're asking, does air pollution cause colon cancer?
Okay. No, so air pollution is
Yeah.
linked to lung cancer, for sure. Obviously air pollution goes directly to the lungs, but not seem to be linked to colon cancer. So not good lah. It can cause lung
Mm,
diseases. It can cause all sorts of. It's well known that highly polluted cities, the residents there have a lower mortality, meaning they die a bit younger. For all sorts of
mm.
reasons. But not a direct link to colon cancer.
Yeah, I think in Singapore, with our air, I mean, quality is still relatively, safe, right?
Yeah.
I mean, even if you talk about air pollution, we don't get quite that much here,
Yeah.
right? So, Bikim is asking which type of colon cancer will require patients to have a colostomy, and
Mm.
is it temporary or permanent?
Okay. Now, so this one, it for which patients who have a colostomy, which is what for those who don't know, it's a stoma bag. A stoma bag or colostomy is whereby temporarily you or permanently you pull out the intestine out of the skin and then and you put a bag in, and then the stool comes out from there. So you no longer pass motion through your anus; it comes out through your bag. Now, which patients need it? It depends on where the colon cancer is. The colon, as you know, is quite a long intestine. Is on the right side is what we call the ascending colon. Then in the middle is what we call the transverse colon, and then the left side of your tummy is what we call the descending colon, and then it goes all the way down to the rectum. Now, generally, you may need a colostomy depending on how large the cancer is, and depending on how much the stoma has to come out and where it is. The surgeons are often the ones who may have to make this decision. Almost definitely, all rectal cancers, the ones that are very close to the anus, have to have a stoma bag. And then most right-sided cancers, which those on your right side of the tummy, generally don't have to. But it's all depends on a few things, how large the cancer is as well. So this is something the surgeons have to decide. It's not there isn't a simple answer to it. Whether it's temporary or permanent also depends on how large it is, where it is, and whether the surgeon is confident of you getting a good result of putting your intestines back and you having normal bowel movements after that. So it also depends on how much he has to chop out. Because if he chops out a huge chunk of the intestine, even if he can put it back, it may be that you may have your quality of life may be worse after you put it back, because you're just in the toilet like 18 times a day, 20 times a day, because you don't have time for your nutrients to be absorbed because your intestine is now so short. So sometimes in those scenarios, we actually tell them it's better to have a stoma bag. This is very much a surgical decision rather than an oncology decision. It's something that has to be discussed with the surgeons who do the operation.
Okay, we got another question from HS Yo. He claims that he had done his second colonoscopy at
Yep.
62.
Yep.
He's cleared for both
Yeah.
session, right?
Yeah.
And is it worth the money to go for another one?
Sure.
And
So
is there a difference between one done at a private hospital or a public hospital?
okay. So first question I answer: if you had your second colonoscopy at 60 years old, 62, and it was clear the second time, clear being completely normal, then usually we would say 5 to 10 years later lah, before you need to do your next one. So you don't have to do anything earlier than that. Now, some people think it's clear, but they actually not clear in that they didn't find cancer, but actually the surgeon found polyps. Now, if they found polyps, sometimes the surgeon will tell you to come back earlier, like within like 1 year later, even sometimes for high risk polyps, or 3 to 5 years later. But if it's really completely clear, whereby you absolutely didn't see anything at all, then there's no need to do a colonoscopy. I know it's funny, but we say 5 to 10 years lah. So you can do it 5 years later, you can do it 10 years later. You're going to be safe. Difference between private and public is
Public.
that once again, I'm not the one who do the colonoscopy. I guess in private, of course, it's more expensive. You can choose your favorite, doctor you want to do, the one that you find you like the
Yeah.
face or you think is popular,
Yeah.
and all that. You go to him or her. Whereas in public, generally you may not be able to unless you go in as a private patient. Usually, I mean, during our training and all that, most of the colonoscopies in the public system are done by the training doctors lah. Meaning that these are doctors already. They're training to be surgeons, training to be gastroenterologists. They are usually the ones who do the colonoscopies. So you will be done. Your colonoscopy will be done by a doctor,
Junior.
but it will be somebody who's training to be a
Mm.
specialist.
Yeah.
So these are the things that you need to think about lah.
Mm.
But it's of course a big
Yeah.
price difference.
Yeah, and if I may add, I think it's also the wait time. I mean, the waiting
Yes,
time,
that's right.
to get an appointment versus, the
Mm.
private and the public. I think that's
Especially
also the
now.
one reason. Yeah,
Yeah.
and that's the one reason why we
Mm.
started this ground up initiative, uh, my first colonoscopy campaign, because we want to fast track those who needs a colonoscopy, much
Yeah.
faster rather than
Yeah.
waiting around, right?
Yeah.
So I think we are kind of running out of time, but we try to get to a couple more questions, right, before we so-called end this session. Sharon has a question asking you to elaborate about the surgery as one of the treatment steps. I'm not
Elaborate about
sure.
surgery. Okay, so I
Mm,
am not a surgeon. I'm probably not the best person to elaborate about surgery. Of course, because I see so much colon cancer, I have a rough idea. But usually surgery, Sharon, if you want to know, it's needed for almost all colon cancers, lah, whichever stage. Mainly because for colon cancer, whether it's stage 1, stage 2, stage 3, stage 1, stage 2, stage 3, you need the surgery to get rid of the cancer. But even for stage 4 cancers, we normally get rid of, you need surgery to make sure the cancer doesn't cause blockage of the bowel, and cause you the poor quality of life. The surgeries that they often offer are what they call a colectomy. Colectomy is just a removal of the colon, a part of the colon. So how much to be removed depends on how big the cancer is, where the cancer is. Usually, I have to say, not for colon cancer, it's not seen as a big surgery, not a major surgery. Most patients have it done and easily out of the hospital most of the time within 1 week. So it's not seen as a major surgery, not really a very high risk surgery. Once again, I'm not a surgeon, but I always hear my surgeon colleague friends or friends joke with me that the right-sided colons, especially what we call a right-sided hemicolectomy, is one of the easiest operations to do, and they were like housemen or medical officers when they train, they already all told to do it on their own already. So that gives you an idea that it's not really a difficult surgery compared to many other types of surgery.
okay,
Hmm.
last few, right? From Christopher, is keto diet recommended for diet control?
Uh, okay, definitely not recommend.
Mm,
Not definitely not proven to lower your risk of cancer. So I can't recommend it. This being a cancer talk, to a keto diet for any of my patients to reduce their risk of getting cancer. If anything, even a high fat diet may be bad even for cancer. But in terms of diet control, in terms of weight loss, there's certainly some suggestion that a keto diet may work. But I think you won't find many doctors advocating a keto diet. Once again, it's one of those trendy things. It's fancy now, and we've all been around long enough to say that in a few years' time, it won't be trendy anymore. Nobody will talk about it. There'll be some other diet, because these diets, the paleo diet, keto diet, the Atkins diet, all these diets have all come and gone lah. It's very much a
mm,
trendy thing for all people who want weight loss. But preliminarily, it seems to have some data that helps with weight loss, but not for cancer.
okay.
Hmm.
Right, we'll take one last question from Gyokti. Right, she's asking if yearly FIT is normal, can we conclude that a person does not have colon cancer, or is it colonoscopy is
Yeah.
still
So
necessary?
like I said, the FIT, we still try to recommend everybody to do at least a colonoscopy, because the FIT has what we call false negatives as well, meaning that it looks normal, but it's not
Mm,
normal. I mean, now many people can relate as well. There are many,
mm.
I shouldn't be saying this,
Nothing is
but there's
100%,
many,
I
for example,
suppose.
COVID, there's many ART negative, and it's obvious they have
Mm,
COVID, and the ART is all negative. And it's a little bit like that simply because the viral load is so low in the nose, and you
mm.
already do a PCR, and yet we're not doing a PCR. So, okay, sorry, don't quote me on that. But
Okay.
it's the same with
Mm,
FIT. You can have a rectal cancer, and if it happens to be in a position where it's not bleeding, you know,
mm,
and sometimes colon cancers are like that, then it's going to look, your FIT will come back as normal when actually there is a colon cancer sitting there. So it's
mm.
not the best way. But once again, if you're doing it annually every year and it's always normal, it's unlikely that you will have colon cancer. But that we can miss it.
Okay.
Yeah.
I just want to address so-called two questions here. I think one is from Frostbite Cool. I think due to the nature of your question, because you're dealing with a minor, a 11-year-old, I would suggest that you consult a doctor
Yeah.
on the
Yeah.
condition rather
Yeah,
than
that's
for
right.
us
I
to
think
discuss
for,
it
for
here.
for for something so specific,
Yeah.
it's best. I wouldn't be able to give you a proper answer. So
Mm,
maybe
mm,
just best
mm.
to just bring you. If you already have,
Yeah.
then maybe bring to a pediatrician and something to address
Mm,
it
mm,
at
mm.
that level lah,
Yeah.
because it is very
Because
specific.
Yeah,
Mm.
because this session is not a telemedicine or
Yeah,
teleconsultation session,
yeah,
so without proper diagnosis, we won't be
yeah.
able to give you the correct answers. And then Gyokti was asking how to book a colonoscopy with your clinic. I suppose
You
it's
can't. You can't,
yeah,
right? Because I don't do colonoscopies, right?
precisely.
I sorry, guilty. I am
Yeah.
so like I said, it's a multidisciplinary team. right? The
Mm,
whole idea of me doing colonoscopies is something I detest. I
mm.
I don't understand how I have friends who actually
You,
make this a specialty.
you
But you know,
you just don't like to see places where the sun don't shine, lah, I suppose.
yeah, that's right. So I look after colon cancer patients, but I look after the chemotherapy, the management,
Mhm,
and all that. But I don't actually do the surgery. I don't do the colonoscopies. But
mm,
there are many doctors who do, many good doctors who do it. You know,
mm,
surgeons and what we call colorectal surgeons, general surgeons, and
mm,
gastroenterologists. All these people are
mm,
the ones you should be looking for, and
mm.
many fantastic ones out there.
Yeah, I totally agree. I think,
Yeah.
I mean, that's for sure. I just did my gastro, a couple of weeks ago, and due to review my results. I think there's a lot of good doctors out there that is very concerned with everyone. I mean,
Yes.
with everyone's in terms of colorectal cancer and other form of cancer. But really, I really appeal to everyone, to get screened early, right, and follow the regime of getting screened, because early detection really increase your
Yeah.
chance of a full recovery, if not, also a chance of survival. So that is something that you must always be in mind. So once again, right, thank you very much, everyone, for your participation, and of course, Dr. Shang, for
Yeah.
your very informative answers to all the questions that we have tonight. And for those who haven't got your answers to your questions, not to worry. You can always join us at other sessions. Then you can once again post your questions, or if you really have a burning questions, you can feel free to email us. We will get in touch with Dr. Shang to see whether he's able to answer your questions. But really, I appeal to everyone, if your questions is really too personal, best is to go and see a doctor, get a one-on-one session with your physicians or your GP, right? They will be able to really, make the right diagnose, and also, advise you, in what are the treatments and the pathways that you need to get yourself sorted out. All right. So once again, thank you very much, Dr. Sheng, for being with us tonight, and
Pleasure.
really taking the time. I hope you have a great time, joining us
Thanks, Andrew.
tonight too.
Yeah.
All right.
Yeah. Thanks everybody for your questions. Thanks for being such a participative audience. Always more fun whenever there's good audience participation.
Yeah, that's right. Right. Thank you, Dr. Sheng. I'll see you in a
Okay. Good
bit.
night. Good night,
Right.
everyone. Yeah.
Right. Now, so for some of you who have more questions, I know definitely, looking at the kind of questions that's coming fast and furious from everyone, right? So we actually have, another options for you to really ask your questions, which is, the doctors from Icon Cancer Center, right? You could actually do a yum cha, with the doctor. So if you are interested, you can always sign up for this closed group online workshop, right? By scanning on the QR code to register, right? Currently flash on the screen, right? We have limited slots only, so do sign up early if you are interested. And if you would like to know more, you can always drop us an email to find out more. What is this Yum Cha with the doctor? Whether it's a physical thing or it's virtual, and really got dim sum or not, ha gao siu mai, cha siu bao, right? You can always do that, and feel free to ask us what is this Yum Cha with the doctor is all about, right? And it's one of our new workshops that we, collaborated with Icon Cancer Center. Now, so once again, I would also appreciate, right, and appeal to all of you to give us your honest feedback about tonight's session. Maybe you think, Andrew, you talk too much. Can you talk lesser? Let the doctor talk a bit more. Yeah, feel free to give us your feedback, right, about tonight's session, and also what other topics would you like us to feature in the future. Right, you can scan on the QR code. It leads you to a feedback form that you can fill in, and or even give us your comments on our comment section. Now, I think this is another segment that everyone is very much anticipating. I see that everybody is still hanging around waiting for the results. So now for the winners of our Facebook contest, well, this one I would say the question must be very easy, yeah. So everyone really rocks, right? So much of response, right? Overwhelming, and really so many answers and comments. Thank you very much for your enthusiastic participation, right? So do look out for more contests coming your way, all right? And you can always participate. So the winners for this round is KW Chow, Celine Parsley Tan, Andy Tan, B Yong Teo, Adela Chu, right? Please pardon me if I pronounce your name wrongly or mispronounce your name, right? Beg your pardon on that. So, remember, winners, we'll be contacting you on how to collect your prizes, right? Sit tight, don't worry about it. We definitely will get in touch, right? And if you're coming down to collect your prizes, definitely there's more than what we have promised, right? So there'll be some surprises for you too. So be patient, wait for us to contact you, right? Don't call us, we'll call you, right? And if you're unwell, right, and you intend to come down and collect your prizes, do let us know. No worries, we can always reschedule your collection for you, right? So take care of yourself first. So if you are feeling unwell or you are, COVID positive, please do not come down, right? We will send you the details and soon, right? So our next Facebook Live talk session will be on 结直肠癌, which is basically Mandarin for colorectal cancer, right? And this time round, the session is in Mandarin. So for those of you or your family and your friends who have missed this session, or you think you want to know more about colorectal cancer in Mandarin, so I strongly encourage you to join us in this session, right? The speaker will be Fu Guohan, right? 顾问医生, right? From Thompson Medical Center, right? The session will be held on 19th of March, which is a Saturday, right? At 8:30 p.m. Once again, over at our 365 CPS Facebook page. Now, the more details is currently fresh on the screen, so you feel free to sign up and join us next Saturday for this session. Now, lastly, for more information and also to stay up to date about us, 365 CPS, and also Icon Cancer Center, our activities and events, do visit both of our official websites. Follow us on our Facebook, Instagram, and Telegram. And don't forget to like, share, and comment on our social media pages so that more people can benefit from our charitable work and services. Now, once again, thank you very much for joining us tonight. And also to our two sponsors for this session, Icon Cancer Center and Pfizer, our education awareness sponsor. So I hope to see you all in the next upcoming session. Once again, do take care, stay safe all, and good night. Have a good weekend. Thank you, everyone. Bye.